panelists for their fine testimony. These questions will go to Dr. Patel. I want to thank you for being here today. Please answer the following questions, yes or no. Is it fair to say from your testimony that fee-for-service models do not promote the highest quality and highest value health care? Yes or no?
Yes.
Is it also fair to say that models such as the patient-centered medical home have the most promise to provide our citizens with the best and most affordable health care? Yes or no?
Yes.
Is it possible that other benefits from these things could occur, such as a reduction in both cost and the rate of growth of cost?
Yes.
Now, Doctor, I believe that on March 23, 2010, the President signed the Affordable Care Act into law. I'm sure you're aware that ACA provides a shared savings program through accountable care organizations that serve 2.4 million Americans. Is that right?
Yes.
Now, Doctor, ACA is legislation that includes the authority to embark on many innovative paths. I believe that is a desirable thing, is it not?
Yes.
Now, Doctor, are you aware that CMS programs such as Innovation Advisors and Innovation Challenge grants that seek to promote groundbreaking work in healthcare, would you say that is useful, yes or no?
Yes.
By the way, Doctor, I'm sorry to do this to you. You're a very good witness, but I've got a lot of questions and not much time.
No problem.
Dr. Patel, it's clear from your testimony that you understand the importance of excellent primary care. This is an area of great shortage in this country and potentially worse shortage, is it not?
Yes.
Did you know that CMS has a comprehensive primary care initiative that encourages public-private collaboration on promoting primary care? Yes or no? Dr. Patel, I think we both agree that CMS must do more to reform physician payment systems. Is that your view?
Yes.
And I hope you also recognize that the Affordable Care Act is assisting CMS in beginning the important process towards these vital reforms. Do you agree with that statement?
Yes, sir.
Doctor, do you want to make a comment as to how that particular process is working? This is not a yes or no.
Thank you. Yes, I'm happy to just briefly tell you that I do know that CMS has been working, even with the most recently mentioned physician payment rule that was released last week, to add modifications that acknowledge some of the issues we've discussed today around the relative value of some of fee-for-service elements, as well as ways to better integrate quality with what work that is already going on in clinical specialty societies and primary care.
Does that offer promise for the future in addressing these miserable problems we have?
It does, sir.
With regard to cost increases and things of that kind?
It does, and it also offers insights into what we need to do more work in, even outside of the Medicare program.
Now, how is it that this program is going to benefit us in terms of addressing cost increases and the rate of increase of costs?
It all has to do with making sure that what we're incentivizing, where we put the dollars, actually matches towards the value that has already been identified that we do not attain in this country. So it's really about taking resources that we know are not going towards valuable care and redirecting those towards things that we know promote value. And those come from the very work that we're hearing about that are led by clinicians.
Now, you just said something very important. How do we do that?
So
what are the steps that we take to make that
the
happen?
very short-term steps over the next 2 years, for example, transferring a proportion of what we do in fee-for-service payment right now into this coordinated care model that we're discussing. It's even beyond the patient-centered medical home. It could be a model that allows for an oncologist, for example, to better coordinate care for a colorectal cancer patient. And then from that point, what we can't do is leave it alone at that step. What we must do is transfer and think about how that money, those dollars and care coordination, can not only be reinvested back into the system, but what savings we create from that can move towards either these larger kind of episode or bundled payments that we've discussed, or other mechanisms that other physicians have brought up today.
Do you believe that the medical profession will support that?
I believe they will, and I believe they've already been putting these models forward, sir.
Thank you. Thank you, Mr. Chairman.
Chair thanks, gentlemen, and now recognize the gentleman from Ohio, Mr. Latta, 5 minutes for question.
Well, thank you much, Mr. Chairman, and thanks very much to our panel members for being with us today. It's been very enlightening. And if I could start, Mr. Serrato, if I could ask you, kind of interesting in your first page of your testimony, you state that U.S. healthcare is spending